went straight to a double mastectomy. And I got a lot of eyebrows raised of like, are you sure you want to do that? Because I had all these choices of less aggressive treatment. And I was like, no, I want a double mastectomy because I do not want this to come back. I got all the statistics, all the numbers, all the advice. And I would say, honestly, within about a week, I became pretty firm about that choice of a double mastectomy. And it has been probably the best thing I ever chose. And that is something people kind of also question for me, but I can tell you it was the best decision I ever made. My name is Erica Newbert Campbell, and I am a woman who has multiple perspectives on cancer. First of all, I'm a breast cancer survivor. I also lead a nonprofit that helps children with cancer and their families. And I also call myself a cancer orphan because I lost my mother to breast cancer over 20 years ago today. And it's these multiple perspectives on cancer that makes me incredibly interested in not only other people's journeys, but sharing my journey so that it can help other women who come either after me and those that have come before me too. Well, I was diagnosed in 2018, so about 6 years ago, and it came on after I would describe as about a solid 10 years of scary mammograms. And because as you can imagine, my mother had died of breast cancer, so I was on high alert. And I met with tons of doctors who said, I have equal risk of any other human in the population. I had taken genetic testing and I wasn't BRCA positive, but I still just didn't feel good about my health journey, given my mother's really unfortunate diagnosis and death. And so over that 10-year period, I had mammograms, ultrasounds, MRIs, and they would always see something just a little bit scary, right? And meaning they'd say, well, why don't you come back? And they'd give me, a higher level of screening. And then they would say, oh, it's fine. But it just built up this anxiety for me over the years. And so, because they had started to see some abnormal things, particularly calcifications. And calcifications are like potentially an early sign of breast cancer. It got to the point where I was like, okay, when are we going to take this a little bit more seriously? So when I went to just a routine mammogram, I was getting them every 6 months. This was the one time where they were like, let's have a biopsy. I'd never had a biopsy. And that was the part where I was like, all right, so this is going to get a little bit more serious. But, I don't know. It's looking back, I'm not sure if I was surprised by the diagnosis or if I was like, yeah, finally. But as the reason I'm here, I did, after that biopsy, get the diagnosis that it was DCIS, which is ductal carcinoma in situ. It's an early stage breast cancer. And, many people can say that's the good kind of cancer. Well, there's no such thing as a good kind of cancer. And stage 0, while that sounds great, still requires a fair amount of intervention and a fair amount of choice, which became the most overwhelming part because it was starting to come at me like a fire hose with all the choices. The choices that came at me so fast and furious ranged from everything of like little consequence, like I could choose to do nothing, right? All the way up to a double mastectomy and everything in between. So I was given the choice of a lumpectomy, just to remove the part of my breast that showed this early stage breast cancer. I was also given the choice of hormone therapy. I was given a choice of radiation, even the choice of some chemotherapy. And they all ranged amongst a spectrum. And again, one of the things that either I, quote, benefited from was that my mother's journey had been a really painful one because hers also started out as an early stage breast cancer. And at the time for her, doctors were like, oh, this is not a big deal. As you can know by the result, it became a really big deal because she relapsed 4 times over her journey. And it came back bigger, stronger, more invasive every time. So for me, it became this choice of how do I rewrite the story? How do I advocate for myself in a way that maybe my mom didn't? Maybe she didn't have the right information at the time. A double mastectomy is a pretty radical choice. In fact, the clinical name for it is a radical mastectomy because actually, I'm not sure why, but they're taking everything, right? And that's another piece of the choice is that once you choose a double mastectomy, it is a removal of your breast tissue. A choice that you get to make is, do you want to also remove your nipples, or would you like nipple sparing surgery and try to keep your nipples? For me, this was like a fear-based choice. And I actually say that positively, is that if I was going to do such an invasive surgery to essentially remove two near lifetime body parts, I wasn't going to leave anything to chance. So I did choose to have my nipples removed as well. They literally took my entire breasts. And in that surgery, I also had the other choice, right? Choice follows choice, whether or not I was going to have reconstructive surgery. So reconstructive surgery is essentially putting in, a prosthetic, which is like a fancy word for fake boobs. There's a lot of choices about femininity and how you feel about your body. And, I made the choice to do that because while, yes, I can buck the stereotype and say, I don't need breasts and I've already had children, so I don't need them to, be breastfeeding and things like that. Like, check, they've done their job. I also said they did their job and they needed to go. And so I did choose to have that reconstructive surgery. So at the time, it's actually a very extensive surgery. It's 2 parts, though, which is the part I didn't realize at first. I was in surgery for probably 8 to 10 hours. The first 4 were simply removing my breast. I had a breast surgeon who was going to take out everything. They were going to take out some lymph nodes to also test those tissues. And then sort of that breast surgeon did I'm out handoff to a reconstructive plastic surgeon. So for the next 4 hours, and what that surgeon did was essentially go cut into my muscles. Again, a choice I had to make. I could have gone over my chest muscles or under my chest muscles. A lot of choices here, right? There's like choices after choice. I chose to go under the chest muscle, which is more painful. However, it is more long-term security of the implants. And my surgeon said, hey, listen, it sounds like you're all in. It sounds like you're confident. This is going to be more painful. If you choose to go under the muscle, it's going to be more painful. But I can tell you, you will have a better outcome with the implants. They are not going to move around. They're going to be secured into your chest. And then he said, trust me. All right, this is the breast plastic surgeon. Okay, so he's a man, right? He does not have breasts. And, for somebody in that situation, I've just met him. And to have him say, trust me, is quite possibly the greatest leap of faith. I had to trust him. He's saying, this is going to be really painful. And it's going to be better in the long run. And I literally had known him for about 30 minutes. And so that's the extent of the surgery. But that's also the extent of the choices that you just have to continue to make and continue to make. So at the end of that surgery, not only did he cut underneath my chest muscles, he essentially puts, for lack of a better word, 2 balloons under my chest muscles, deflated, totally deflated. And then he sews me up and I look like Frankenstein. I look like a flat-chested Frankenstein. But I now have 2 balloons under my chest. And my job then after that 8-hour surgery, number 1 is to heal. But then also I have to then make the choices of what do I want my breasts to look like afterwards? Because he essentially fills those balloons over time with saline and expands my chest. Have you ever had braces as a kid, like braces on your teeth? That's like the kind of soreness and pain when they're doing that is like what it feels like to have your chest slowly expanded over time. I mean, it's a wild ride. It is a wild ride. And it was painful. It was painful. Right after my surgery, cutting into your chest muscles, you don't realize how much you used your chest, to raise your hand, that's your chest muscle moving. I could not touch my nose. Like my nose itched, and I had to have a nurse or my husband or the doctor itch my nose for me. So I don't like to sugarcoat that, right? It was scary, painful, all the things. And I still stand by it was the best choice I ever made. And I did heal, and I have full mobility now. I work out, I can do push-ups. About 3 weeks after my surgery, this massive surgery, when I looked just like horrible, they would put a magnet on my chest. They would find where that metal piece was, and that's where they would pierce my skin and then essentially inflate the balloon with saline, again, a little bit at a time. So this did take, gosh, I want to say 3 months, because it is quite painful to stretch your skin, to stretch your muscles at the same time where this massive scar is healing. It sort of looked like, my chest looked like a big V, right? There was like a vertical or two scars like this. Again, very big and Frankenstein-y. But they started to heal. And once the stitches came out, and then again, as they're slowly inflating these balloons with saline, I start to see what's happening. And I can start to see that I actually start to look real, right? I'm still wearing loose tops. I'm still wearing tops that zip up because I don't actually have full mobility on my chest. I don't want to put them over my head. But you just start to feel normal again. Not only were they like hard massaging my scars, which I couldn't even believe, but there's like certain oils you can put on. I even had lasering done to reduce some of the scars. So again, like I ended up with this like really beautiful chest just without nipples. I will say that I did have to have another surgery. It was supposed to be easy. There's no such thing as easy in this journey, because they had to take out these temporary balloons and then put in a permanent implant. And so, as you can imagine, I was like, that sounds great. It's supposed to be easy. It definitely was not. I mean, I just think I want to be really honest about the reconstructive process, and that it's not easy. But it was so worth it, right? I wear the exact same bathing suit that I wore pre-surgery. I wear the exact same tight dresses. But here's the kicker. I don't have to wear a bra. My implants, they don't move. And so I get to wear these like backless dresses with nothing. I get to wear fancy dresses that I wore before and, not have that feeling at the end of the night when your bra is too tight and you take it off. Like that feeling doesn't happen to me anymore. So, I can laugh about it now, right? 6 years ago, I wouldn't exactly say I was laughing, but now I am so happy. And not just the way it looks. They look great. They do look great. You would never know. I can wear a bikini and you would never know. But the biggest reason I'm so excited about this, and I'm using that word excited, is that I have no fear. I have no fear of recurrence. And the mental game that I had to go through to get here, for sure was hard, right? You heard about the physical pain journey, like just all the things that were really challenging, but my mind is cancer-free. And that is the most beautiful thing. I don't worry about recurring. I can't get breast cancer. I don't have breasts. And so I don't have to get mammograms. I don't worry about it. And that to me is the greatest gift. I like to be really honest that I did get mental health therapy. And that was at the request of my breast plastic surgeon. He was like, you look great. And he's like, I've been around the block. I really encourage you to get some like therapy. And I'm a really proud person. And I was like, I don't need that. I needed it. I absolutely needed it. And, in the beginning, I did have a fear of relapse because you just never know. But we talked, my therapist and I talked through some ways and some strategies to get around that. And again, my body is cancer-free. My mind is cancer-free. And that is the greatest choice I made. If I think back to 6 years ago, having to make that choice of the mastectomy, if I had had a lumpectomy, I'd be subject to continual mammograms. And we all know that those are anxiety inducing. I'd be subject to hormone therapy. I'd be on high watch. It would not be worth it. And so I will say that a lot of people ask me, like, I get a lot of people who reach out and say, I'm newly diagnosed. What should I do, lumpectomy or mastectomy? And I am confident in saying a double mastectomy. The nipple tattoo journey was also a really interesting one. As I mentioned, I had literally read in People magazine an article about a tattoo artist who simply specialized in nipple tattoos. It was this really beautiful article on how much compassion he had had for breast cancer survivors, and that's where he dedicated his career. It's incredible. And actually, interestingly, I originally was not going to use him because I'd have to fly across the country. It seemed to be like a really big hurdle. And I was just going to go and have it done at my plastic surgeon's office. There was a nurse practitioner that said she could do it. And this is when, you have to trust yourself. And I kept like hemming and hawing about it. And I realized that I wasn't ready for the journey to end, right? Because that is the last step of the entire journey, is the nipple tattoo. And that's when I made the choice to get some mental health therapy first, because I was like, I don't think this journey's over for me mentally. So interestingly, day of appointment, I canceled with a nurse practitioner. And when I talked to my therapist was like, it sounds like this is a really big thing for you. Tell me more about it. And I was like, well, I kind of had this dream about like getting this like fancy tattoo artist to do it for me. She was like, well, then you go do that. And so I made it a thing. And that was really, it was like the celebratory closure thing for me. I drove up there. I'll be honest. You think it was like going to be this big fanfare. It was a tattoo parlor in a strip mall outside of Baltimore, right? There was no fanfare. And I had to walk in alone. I've never had a tattoo. I just am that person that just was afraid of needles. And so growing up in my 20s, all my friends would get tattoos. And I was like, I'm going to peace out. No thanks, friends. And here I am now wanting to get a tattoo, which I thought was also quite ironic. And, part of the reason I didn't get a tattoo when I was in my 20s was because of needles and pain. Now, another part of reconstructive surgery, imagining all the things they're doing with your chest, is that you lose sensation. So I couldn't really feel my breasts. I will say now today I do. But I think what was really interesting is I was starting to get that feeling back. So as I'm sitting with this tattoo artist, he's like, you probably won't feel a lot of this because you're still in this reconstructive phase and your nerves are still healing. Well, sure enough, it was painful. Again, there's a theme of pain here. But again, I started to, dare I say, enjoy that pain because I could finally feel. I could feel my breasts, right? That was something that it was unclear whether or not I was going to get sensation back in my breasts. And to be able to feel the pain of the needles of a tattoo was kind of relieving, obviously kind of painful. I will say that the tattoo artist approached it quite clinically. He was like looking at my breast. He's like, okay, I think I'm going to do this. I think I'm going to do this. And he just went. He didn't really ask my opinion. He's like, you want 3D? You want it to look real? I was like, yes, I do. And he just went to town. And sure enough, 20 minutes later, that's it. I just walk out. Obviously, I put my shirt back on. And then it was over. And it was like truly over then. I have genuinely made this my life. And I would say that is because cancer actually changed my life. And if I back up a little bit, I do lead an organization now that helps kids with cancer and their families. But that journey started probably when I was 22. When I was 22, I was right out of college and I didn't have a lot of purpose. I didn't love my first job out of college. And I ended up volunteering at a sleepaway summer camp for kids with cancer. So I would take a week off of work and I would be the mom to these kids, right? Whether they were 7-year-olds or they were teenagers. I would spend an entire week outside of my current job, my career, with these kids. And those were some of the most life-changing experiences I have ever had. So when then I was personally diagnosed, it was like, okay, universe, I get it. This is what I'm supposed to be doing. Not only is it my career now, but it is my mission to support other women and caregivers because of the many gifts the many gifts that I have been given by other cancer patients. And whether they be kids or some of the, I spent a lot of time in the hospital with my mom. I met other cancer patients there. And while cancer is a club you never want to join, once you do join that club, there are some silver linings. And it's the people that you meet, it's the life perspective that you get, and that is a true gift. My best piece of advice is to trust the process and trust yourself. There is nobody better than you to know what's right. And so while I may have recommended a mastectomy, or I may have said something in this, ultimately trust yourself and trust the process. And that will get you through.